Hi everyone, I promised that I would share facts with you about hormone replacement therapy and breast cancer, and we're going to get into it, but I want to share that this information is based on guidelines. It's based on the evidence that's out there. It's based on guidelines that come from the oncology societies as well as the menopause society. And you may not agree with some of the guidelines. You may think that some of the data is outdated, because it is. But my goal is to share with you what are the guidelines, what is accepted, what's out there, so you can take that information and talk to your doctors about it. And remember, there's a lot of nuance with HRT and breast cancer, so keep that in mind as well. Okay, let's get into it. Number one, low dose vaginal estrogen is considered to be safe in patients with breast cancer. There are a number of studies, large-scale trials, showing us the safety of this. There are different formulations of vaginal estrogen, and the ones you choose are based on your symptoms and preference, and they all work really, really well to treat genitourinary syndrome of menopause. Now, there is some concern that comes up about using vaginal estrogen when someone is on an aromatase inhibitor based on a study that showed a potential increased risk of recurrence. The caveat with that study is that other studies have not shown that risk. This study, we don't know if patients were on a higher dose of vaginal estrogen, because right now we recommend the low dose. This is an older study. It had a small number of patients, and it's also thought that the patients on the aromatase inhibitor in that study were at a higher risk of recurrence to begin with compared to the patients on tamoxifen. So it's hard to tease out that data. And so the guidelines are very clear that we can use vaginal estrogen in someone with breast cancer, and we should be discussing all of these side effects and the risks and benefits. And the guidelines are very clear that vaginal estrogen can be used in someone with breast cancer, even someone on an aromatase inhibitor. We just want to discuss all of this with our patients. Number two, a family history of breast cancer, a genetic mutation that increases your risk for breast cancer, the presence of a benign but higher risk condition like atypical hyperplasia. All of these are not absolute contraindications to using hormone replacement therapy. And this is where, again, that discussion with your doctor, talking about your individual risk, which is based on more than just one of those factors, but taking everything into account and making a decision that is going to be right for you. Number three, the data do not suggest an increase in the risk of recurrence or death from breast cancer when using hormone replacement therapy in someone who has had hormone receptor negative breast cancer. And number four, what about HRT and hormone receptor positive breast cancer? So there's a lot of nuance here and a lot of unmet need. A lot of the data that we have are old. They don't reflect modern day formulations of HRT, bioidentical HRT. They don't reflect how we treat breast cancer now. There were caveats and limitations with how those studies were conducted, but they do show an increase in the risk of recurrence, again, with all of those caveats. And there are some observational studies where they followed patients who chose to take HRT, and those studies did not show an increased risk of recurrence. Now, the challenge may be that those patients are in that low risk of recurrence group to begin with, so it's hard to know how to apply that data broadly. So currently the guidelines do not recommend HRT in someone who's had hormone receptor positive breast cancer, but they do say that it can be considered on a case-by-case basis, weighing symptoms, weighing risks and benefits, and this is where I do urge you to discuss with your doctor. What I do want to stress is that when we're talking about it, we're not referring to vaginal estrogen, we're talking about systemic estrogen. And there are other good ways to take care of menopausal symptoms, both in the short term and in the long term, to protect your bones, your heart, your health, all of your organs. So if you hear the conversations around HRT and you're not a candidate, or you've chosen not to take HRT and it can feel like you're really left out of the conversation, I just want to stress that there are so many things that we can do. All right, this is long enough. Let me know your questions, your thoughts, your experiences, and I would love to answer as many as I can.